All right, good afternoon, everybody. It is March the 26th, and I want to welcome you to our afternoon press briefing. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale. Also with Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Alvin Wong, Director of our EMS Services for the region. So, since our March 25th press release, we have 94 new positive cases of COVID-19 in Montgomery County, which brings our total to 313. I do want to just reiterate one more time that this big jump in positive cases is not unexpected. We have tested over 1,000 people at our community-based testing sites since last Friday, so it's not at all unexpected that we're seeing more positive cases come through, and we fully anticipated that this would happen. These positive individuals are from 32 municipalities, 6 of which are reporting their first cases. The 6 new municipalities are Hatfield Township, Jenkintown Borough, Norristown Borough, Souderton Borough, Upper Hanover Township, and Upper Pottsgrove Township. And as always, the numbers and all the updates to all the municipalities will be posted on our montcopa.org/COVID-19 website. These individuals range in age from 8 years old to 95 years old. The age brackets are as follows. There's 1 person, 0 to 9, 3 people, 10 to 19, 20 people, 20 to 29, 14 people, 30 to 39, 18 people, 40 to 49, 13 people, 50 to 59, 15 people, 60 to 69, 7 people from 70 to 79, 2 people, 80 to 89, and 1 person, 90 to 99. We have 45 females and 46 males. 6 are hospitalized, 44 are not hospitalized, and 44 we don't have information on at this point. I'm also, again, saddened to confirm that a 3rd Montgomery County resident has lost his life to COVID-19. This individual was a 62-year-old male who resided in White Marsh Township and was in a hospital at the time of his death. I don't have any additional information about any coexisting medical problems. So today I wanted to try to get into something that I've been asked several times about during these press briefings, which is first the age distribution here in Montgomery County, and then who's being hospitalized in those different age brackets. So this chart up here on the screen, which I hope you can see okay, lists the same age brackets that I just said when I was going through the cases. We start at 0 to 9 on the left and go all the way up to the 90 to 99 on the far right. And then on this side, we have the number of cases. So the orange represents the total number of cases. So you can see that the age group here in Montgomery County with the most cases is the 50 to 59 years old group. But there's nearly as many 40 to 49s and 60 to 69s and 30 to 39s, and we have a lot of 20 to 29s. So we have a pretty good number of people in each of those adult age cohorts that are testing positive for COVID-19. But what I want to emphasize to you, and this is what we've been talking about in terms of populations that are more at risk than others, the dark teal, so this color, those are the individuals within that age group that are hospitalized. So of that total, the smaller dark blue or teal box represents the number of people within that age group that are hospitalized. And then there's definitely some uncertainty in this because that lighter blue color are the people that we don't have information on as to whether or not they're hospitalized. But nonetheless, I think this gives you a sense that as you get older, you see a much higher proportion of the people requiring hospitalization. And so this has been our message and our point to younger adults, that you need to stay home too. Because if you get sick, chances are you won't be hospitalized, although you can see we have had some people in the 30 to 39-year-old group hospitalized. But if you're in your 20s or 30s, you're more likely than not to have a mild form of the disease. But if you expose others, if you expose your parents or your grandparents or a coworker or someone who's immunocompromised or has serious underlying medical conditions to this disease and they catch it from you, the chances of those people being hospitalized are much higher. So this is why we have to pull together as a community, which we have done to a pretty amazing degree, and work together, support one another, and stay home. This is how we beat this disease. All right, I want to give a couple of updates on our community-based testing center. As you know, we've been up and running since last Friday, and again, I want to thank Temple, Ambler, Upler, Dublin Township, and the Pennsylvania National Guard Medical Unit, as well as all the county departments that have been assisting at the site. You may have seen on social media that yesterday the site needed to be shut down about an hour early. That was due to some supply issues. We were actually too efficient in our testing site, so we had to shut down there a little bit early. The site is open today for anyone who was turned away yesterday. So if you had an appointment yesterday and you did not get a test taken yesterday, you can come back today. You can just show up, and you can show up until 6 p.m. Is that right? Yep, you can show up today until 6 p.m. You don't have to call anybody. Just show up. We'll have your name on the list from yesterday, and we would be happy to do your testing today. Starting tomorrow, Friday, and Saturday, we will be open from 10 a.m. to 4 p.m. And you can begin to register for appointments for tomorrow morning at 8 a.m., either on the website, moncopa.org/COVID-19, or by calling 610-631-3000. So if you, and I'll go through the categories in a minute, if you fall into one of the testing categories, tomorrow morning at 8 a.m., you can either go online, which is our preference, or call and go ahead and make an appointment for starting for tomorrow. We'll be open tomorrow, Friday, and Saturday. We will be closed on Sunday, and then we'll be open again on Monday. Just to review who we would like to see at our site, persons of any age and who have symptoms of sudden illness like fever or cough or shortness of breath, loss of smell or taste, or gastrointestinal symptoms such as nausea, vomiting, or diarrhea. Any first responders or healthcare workers who are concerned that they've been exposed or have been told that they were a direct contact of someone who's positive. And anyone at this point who's a known or direct contact, known or suspected contact of somebody with COVID-19. And then if your doctor's told you that you need to be tested and you haven't been able to get a test, you're welcome at our site. Due to the limited number of tests will be reserved for the higher risk categories of individuals that I just described. Generally healthy individuals who have mild symptoms and no underlying medical conditions should remain at home and self-isolate as long as you're able to manage your symptoms. If your symptoms are more severe, you definitely check in with your doctor or a healthcare provider and follow their advice. And of course, if your symptoms are life-threatening, do not hesitate to call 911. We are fully prepared and ready to come get you. All right, with that, I am going to turn over to Commissioner Lawrence, who has a very exciting announcement.
Thank you, Val. Montgomery County nonprofit organizations have been doing tremendous work to support our most vulnerable residents who are impacted by the pandemic, business closures, or social distancing precautions. And it's truly been incredible to see how nonprofits have stepped up to support our residents and ensure that necessary services such as food for the hungry, shelter for the homeless, services for seniors and veterans and others continue. And it's been equally amazing to witness the generosity of our community. Residents have been volunteering, and they've been asking where they can donate their time and resources to help. So we're grateful to our local foundations who have come together to provide new grant funds for this crisis. I'm happy to announce today the launch of the Montgomery, PA COVID-19 Response Fund. The Montgomery, PA COVID-19 Response Fund is a community initiative to support nonprofit relief efforts to the COVID-19 crisis. Through this countywide fund, Montgomery County residents are able to donate directly to the COVID-19 efforts here in Montgomery County. And we want to thank our local philanthropic partners for the Montgomery, PA COVID-19 Response Fund, BLBB Charitable, Health Spark Foundation, the Montgomery County Foundation, Pottstown Area Health and Wellness Foundation, the VNA Foundation of Greater North Penn, Amerisource Bergen Foundation, Pottstown Area Health and Wellness Foundation, Inc., the Philanthropy Network of Greater Philadelphia, the Gennardi Family Foundation, Bucksmont Collaborative, Tri-County Community Network, Interagency Council of Norristown, and Montgomery County. $205,000 have already been committed to the fund. And these funds will provide emergency grants to support local nonprofits working with residents most impacted by COVID-19. Nonprofit organizations that are looking for grant funds to support their COVID-19 relief efforts in Montgomery County may apply for grants up to $5,000 starting today. Grant applications will be reviewed quickly and on a rolling basis to ensure that funds are distributed as quickly as possible to nonprofits during this hard and important work. There is a link to the fund on the county's COVID-19 data hub at www.montgomery.org/COVID-19. And now I'd like to introduce Virginia France, who is the president and CEO of the Montgomery County Foundation, and thank her for all her hard work in setting up this fund, for a few words.
Thank you, and the first thing I want to say is thank you to all of the commissioners. The support has been very, very good, and we are very appreciative of it. To respond to this unprecedented crisis, the founders of this fund that were just mentioned have worked very hard in the last couple of days to set up an active fund. It's a collaborative effort with foundations, government, hopefully corporations, businesses, individuals, all stepping up to support Montgomery County communities. And that's what it's about. It's about communities being able to stay strong and not lose their foundations. We're most grateful to all of you who have already given to the fund and to those of you who will be giving to the fund. To help grow this fund is an important goal. You'll be helping your local neighborhoods. You'll be helping really just making it sustainable. You will be, your funds will be channeled quickly to local organizations making a difference. And as Commissioner mentioned, you'll be able to donate directly with the links that we're given. I want to thank the founding partners again for all of their work. They have been working tirelessly. We need to grow the fund. It will be important because while we have great commitment now, the $205,000 is very important, but we're hoping that other people will actually commit to that, that fund as well. We want to be able to not only go through the emergency part of this and the rapid response part of this crisis, but we want then in the long term to be able to help organizations to recover, to continue their service. We have a strong history of collaboration in Montgomery County between philanthropy, the county, our business community, and our residents. This is just one more example of what you're going to accomplish together as opposed to separately. It will provide and grow thriving and strong communities. It's a privilege for Montgomery County Foundation to be a part of assisting in the role of supporting these agencies and the communities and all of you. Thank you.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale, and today I'd like to provide an update of resources available to help our small business community here in Montgomery County. We realize that small businesses are suffering the most from this pandemic, and we are working on ways to bring them relief. Yesterday, the governor announced the Pennsylvania Industrial Development Authority Coronavirus Working Capital Access Program. This program has $61 million available for lending and a maximum borrowing amount of $100,000 per applicant. Businesses eligible for a loan include any for-profit businesses located in Pennsylvania with 100 or fewer employees worldwide. The loan amount can equate to 3 months of working capital business expenses, but will not exceed $100,000. The interest rate is 0% for all business types except agricultural producers. The term of the loan is 3 years with no payments required in the first 12 months. Final decisions on the loan approval are being made by program staff in Harrisburg. Loan closings and disbursements of funds are also being handled at the state level. For Montgomery County businesses interested in applying, visit montcopa.org/commerce and click the link at the center of the page that says COVID-19 Working Capital Access Program. These words are in all capital letters and in red font. Again, it's COVID-19 Working Capital Access Program. Potential applicants will find the program guidelines and a listing of all required application documents and exhibits on that page. We have already had a high level of inquiries about this program and expect that the statewide program will be overwhelmed with applications in the coming days. We ask for everyone to be patient with our staff and our partners working on this program. Another resource available is through the United States Small Business Administration Eastern Pennsylvania District Office, which is holding daily webinar training sessions on the Economic Industry Disaster Loan Program. These webinars will help businesses understand who is eligible for a Small Business Administration disaster loan, what information you will need to prepare and file a disaster loan application. And these webinars also include question and answer sessions devoted to answering questions that small business owners may have. These webinars began this week and will continue through Friday, April 3rd. They are offered Monday through Friday, and each webinar starts at noon and concludes at 1:30 p.m. For additional information about these webinars, please call the Small Business Administration District Office at 610-382-3062. Again, that's the Small Business Administration District Office at 610-382-3062. We are confident that these programs will help sustain the local economy in Montgomery County, help small businesses feel the negative impact of the pandemic we're facing, and hopefully get our residents and businesses back up and running as soon as possible. Thank you very much, and I'll turn it back to Commissioner Arnquist.
Thank you. Well, I just want to add my thanks to Virginia Franz and the Montgomery County Foundation and all the wonderful partners that have come together to help our community. This is really going to make such a huge difference, and we're really grateful for your work in helping to coordinate all this. And we really hope that people will donate anything that they can if they're able in this very trying time. And I just want to point out that you're hearing about all these wonderful things here to help our community get through this, and I could not be more proud of our community. People are donating their time, their treasure, they're donating items. Our business community has come together so strongly to help marshal resources. We have businesses that are changing their manufacturing process to make things that we need right now, like hand sanitizer. It's really been an extraordinary experience to watch this happen here in Montgomery County, and I honestly could not be prouder of the people that live and work here. But what I want most of all is for this to be over. And I want to reiterate that the way we get there is to stay home. I do not support loosening of any of the very robust measures that we currently have in place, because this is how we beat this thing. The virus has to have a human being in order to spread. Yes, it can sit on a countertop for a little while, but only for some number of hours, maybe, a day or two. But if a human being doesn't touch it during that time while it's still alive, it dies. So the key here is to keep all of us human beings at home, not interacting with people beyond our household contacts. The more we do that, the quicker we do that, the more completely we do that, the quicker this thing is going to be over. We have a choice here. I know there's two philosophies on this. If you have a Band-Aid on, some of us like to just rip the thing off quickly and get it over with. Other people like to really do it very slowly and it takes forever. That's where we're at. We can have some short-term pain, no question, some short-term economic hardship, and you can, I hope, understand that we are all working together to minimize that hardship as much as we can. Or we can loosen these robust measures that we've put in place around social distancing. And what that's going to lead to is taking that Band-Aid off really, really slowly. And if we do that, we could be in this situation literally for months. The chances of our healthcare systems being overwhelmed go up exponentially if we loosen these restrictions, let people get out, let this virus continue to spread. So I know this is hard. I really feel for everybody who should be working and wants to be working and can't be working right now. I feel for every parent who has a child of any age. It is tough, and it's really tough for our kids who should be learning right now and instead are at home. So these are tough things. These are real things, and these are going to have impacts for a long time. But the more we do that now, the quicker this is going to end. And if we do this together and we hold tight on this will be over much more quickly than if we drag this thing out by loosening restrictions. And with that, I will take questions.
Well, if we don't want to loosen restrictions, where are you on tightening things up? During the governor's news conference earlier, I was watching it on Facebook and saw many comments after comment after comment saying, why not just shut down the whole state? Would you favor that plan? Are you at that point where you'd like to say to him, to the people in Montgomery County, the hard-hit county, let's shut everything down?
Well, here in Montgomery County, we supported, as I said the other day, the governor's order to issue a stay-at-home order here for us and for the Southeast. I really urged him to do it for the entire Southeast region. The virus doesn't care about government borders, right? It's going to go where the people go. And so the broader an area that is shut down, the quicker this thing is going to go away. So I can't speak to the entire Commonwealth. Honestly, I don't have the data in my head for the whole Commonwealth. I think there's still counties that have no spread. But just because they don't have it now doesn't mean they're not going to. So even if you're not under a stay-at-home order, you should really minimize what you're doing. Minimize your travel. Minimize your errands. Wash those hands as much as you can. If it's not where you are now, it could be there tomorrow. So again, I think the more people that stay home, the better. I would not be in favor of loosening any restrictions in the Southeast at this point. We're just not there yet. We have not seen our cases level off.
And with that in mind, understanding, just to ask you very bluntly, there's conversation at the federal level of setting things up where you could reduce some restrictions in some places. Does this work if one place is really tightly restricted, one place isn't, or does everybody need to be on the same page?
It will happen much more quickly if everybody's on the same page, as I was illustrating earlier. So for instance, if Montgomery County kept our strong restrictions and Philadelphia relaxed their equally strong restrictions, that would be a problem because people go back and forth between Philadelphia and Montgomery County to work every single day. So we do have to be in this together. And at this point, we have not seen even the plateau yet of our curve, much less it's starting to come back down in terms of new cases. So we need to carry on. I know it's incredibly difficult, but it's a lot of short-term pain, and then hopefully we'll be done. Or we can drag this thing out for months with, I believe, that if you look at what's happening in other countries, much more dire economic consequences and potentially catastrophic impact on our healthcare systems.
I have a couple. I'll just do them real quick. Okay, so for our testing testing that we're seeing, is that now from the community-based testing? Are we starting to see a lot of those test results come back from the site in Ambler, and that's where we're seeing the jump, or?
It's a mixture, so we still are getting tests that hospitals are doing and other testing sites. For instance, there's a, Tower Health has a community site in East Greenville, or I'm sorry, Gilbertsville that people can go. So we're getting them from all over, but I do have information on our testing site. So as of the end of day yesterday, we had tested 1,631 people, and we have gotten results back from 429 on 429, so 26% of those are back. And we've had 95 positives in total of that group, just of that group.
At 429?
Yeah, so 95 of the 429, which is 6%. And 330 individuals have been negative.
Another question I had, Commissioner Gale, you had mentioned on Wednesday about PPE and prioritizing it to get to first responders, and I don't know who wants to answer it, but it was something that you brought up that a viewer is now asking us about.
Sure.
And that viewer wants to know, are we prioritizing first responders over medical patients that need these too, that are going in for things like cancer treatments and they can't get them even when they ask?
So let me clarify that.
How do they get those?
Yeah, let me clarify that. I tried to make that clear when I think actually I said that, but
Okay.
let me just clarify.
Forgive me, I'm just going
no,
through the year.
totally get it. A lot of information is coming to people very quickly. So there are well-established emergency pathways for hospital systems and first responders to get personal protective equipment in any kind of pandemic or other disease outbreak. Here at the county, our first responsibility is to help our 50 municipal police departments, our paramedics, and our firefighters get their personal protective equipment. That's they come to us. So they don't have it in their municipality. Their pathway is to come to the county. The hospitals are on a different pathway. If the hospitals need personal protective equipment and they're running low, they go first to the Hospital and Health System Association of Pennsylvania. And their acronym is HAP. If HAP is not able to obtain PPE for the hospitals, then HAP comes to the county and asks us if we have enough to help the hospitals. So that's how this works. So we've been working very collaboratively, and I'll give you an example. The county made a request to the Strategic National Stockpile that was supported by Governor Wolf and our entire federal delegation. And we've begun to receive masks, those N95 masks, from that stockpile. I don't know the exact number that we've received, but I know we got a number in last weekend. The county kept part of it, but part of it, there was also a delivery made to each of our hospitals. So because we had heard from HAP that they needed it. So that's just how the process works, and it's a well-established process. There's nothing new about this. It's been this way for years. So that's how it goes.
I'm not sure that she's asking so much about the process, but if you have a parent or a loved one that has an issue and you want to get them a mask, is there some way that they can get that? Does it have to come from a hospital, a doctor, if they can't buy them in stores? Is there some helpline that they can get this mask?
I don't have an answer for that. We'll try to get you an answer for that and let you know tomorrow.
One more question.
Sure.
It's all you. Yesterday when you talked about the ethnic intimidation, you mentioned that when people call 911, you have interpreters. I was curious, as we also have our Telemundo station, we have a lot of Spanish-speaking audience members that may have questions too. Is there some place specific they can go to where there may be someone who can answer those questions for them in Spanish?
Well, the way it works for 911 is there's something called a language line, and people might have experienced this in a hospital setting where a healthcare provider and the patient are both on a phone, and when one speaks, there's a person listening and they immediately translate for the other, and they just carry that conversation on back and forth. So that's what we have here at our 911 call center. So if someone calls here, they can immediately activate the language line, and there's a two-way conversation with just the one person in the middle who's translating both ways.
But I mean, if you have specific.
So on our website,
there's a Spanish-speaking portal or something
yes,
so they can get information.
Definitely.
Okay.
So on our montgomery.org/COVID-19 website, we have links to information in Spanish, Chinese, and Korean.
I don't mean to sound alarmist, but we're seeing some numbers coming out of the New York City, North Jersey area that are are climbing quickly. We're starting to see some deaths here in Montgomery County and in southeastern VA. Is there a thought that we are behind them and we're going to see that here? Is you mentioned we're not to the plateau yet. Like, where should people be as far as getting scared, nervous, or?
Where people should be is staying at home. So they should be nervous about what we're seeing in New York. There's a very high percentage of cases of the whole United States are in New York City right now. I have a lot of colleagues who work in various hospitals and things up there, and it's tough. New York has some challenges that we don't quite face here in Montgomery County. You know, they have very high density of population in, you know, block by block by block by block. So I think the fact that disease has spread so quickly there may have a lot to do with the fact that there are probably a lot of people walking around without a lot of symptoms, and in such a densely populated area, you're going to see spread. So yeah, I'm nervous about New York. I've said that I'm nervous about New York in this room many, many times in the last several days. And that if we don't stay home, we could be New York. Right now, with the numbers that we're seeing and in the regular communications that we have with our hospitals are okay. You know, that's the word they use. They all have some capacity. They have pretty much all canceled any elective surgery, which means surgery that's not immediately necessary. And because they've done that, they've got open beds. Pretty much every hospital in the county has open beds. But we don't want to work too hard to fill them, right? That's the goal here. The goal here is to stay at home, flatten that curve, don't give that virus a chance to spread. And if we can keep at this, my hope, my highest hope, is that we shut things down soon enough that we won't be in crisis here in the county. However, we are making plans that we might fill up all of our hospitals, and we are working with other counties and other partners to hopefully set up some surge capacity. We're not sure exactly where that would be or exactly what that would look like yet. As soon as we have anything that's definite, we will absolutely announce that publicly. So while I'm hoping that we won't need that, we are planning that we will. So I don't want anyone to think we're not planning for the worst, because we are.
We've had some listeners ask about why, and I've asked you this before, and I know that the hospitals aren't giving this data of why we're talking about positive cases, but we're not talking about recoveries.
Listen, I wish we could talk about recoveries. So the problem is just a very simple one. The state does not require reporting of discharges. So if someone's admitted to the hospital, hopefully the vast majority of them are getting discharged, but there's no requirement to report that. And then the far bigger number of people are just at home, and although we have staff checking in with them, there's not like a definitive endpoint to say, okay, I'm better. So usually staff checks in with them for the first several days, and if everything seems stable, they focus their limited, power on other people. So we just don't have a hard endpoint for recovery, or no one's calling us up and saying, okay, I'm done now. We just don't have a mechanism to collect that data. So, if we only had 20 people that were sick, we could get that data. But at this point, we just don't have the bandwidth to try to track everybody down.
So is it fair to say that you just have more important things to be focusing on right now than, or
yeah, I mean, I don't want to
guess
diminish the importance
right.
of people recovering. That's a very hopeful thing. That's why I wish we could share that statistic with people. It would be wonderful to say that, this many days in, X% of people have fully recovered. I wish I could tell you that, but we just don't have a reliable mechanism to get that information. You can see we're having trouble getting people to, especially the 20-year-olds, to answer their phone to tell us if they're in the hospital or not. So I think we need to start texting them. I know if it were my kids, if I didn't text them, I would never get an answer. So, it's just hard. And our staff are really busy right now with a lot of work. So, Teresa.
We have two questions from the Philadelphia Inquirer. What's the status of the hospital dashboard that you mentioned on a conference call with reporters? Can you share additional information about the hospitals that are participating? And is there any concrete indication of where the shortages in equipment are?
Yeah. So I was on a national press call yesterday, and I mentioned that we are working here at our Emergency Operations Center to create a regional dashboard that we hope all of the region's hospitals will allow their data to be fed into, and certain pieces of data updated multiple times throughout the day, so that we have a sense of who has room in their emergency room, who has open beds, who has open intensive care unit beds, who has ventilators that aren't in use, which hospitals have workers that need personal protective equipment. Just kind of those really, really important data points that we want to keep a close eye on. So the staff here has done a great job of actually creating the template, and that template is pretty much done. And I believe today that some of the staff was sharing that with the Hospital and Health System Association, that organization HAP that I mentioned earlier. And that will start to begin the conversation with all the different hospitals in the region. Our hope is that everyone will be willing to participate, because it's a tool that can be helpful to all of us in the region. You know, as I said earlier, this virus does not respect any sort of governmental boundaries. So it doesn't care which hospital it's in. So we think that here in the 5-county region, the safest thing is for us to be able to collectively see where the needs are, so that we can work the most effectively and collaboratively together across all 5 counties to help each other out whenever we can.
You noted the closing of the drive-through testing facility. Can you reiterate the time that it'll reopen?
Yes.
And for
So the question was, I had mentioned that the drive-through testing center has been briefly closed because of some supply issues. The testing center will reopen tomorrow, Friday morning at 10 a.m. and be open until 4 p.m. Same hours on Saturday, 10 to 4. We will be closed on Sunday, and then it will reopen again on Monday, 10 to 4, and should be, again, assuming we have enough supplies, open 10 to 4 every day next week. You can, right this minute, the appointment website is down, is closed, but that appointment website will reopen tomorrow morning at 8 a.m. And the folks on the other end of the phone at 610-631-3000 will also tomorrow morning at 8 a.m. be willing to help you make an appointment over the phone. Although we do prefer that you go online if you're able, because then that just leaves the people on the phone free to answer other questions. And that website again, it's our moncopa.org/COVID-19 website. There is a button that says county testing information, something like that, county testing information. If you just click on that, it will take you to a registration page. The criteria for testing are listed on that page, and it's a super simple form. I think it takes you a minute or two to fill it out. We don't ask for insurance information or anything like that. It's just to get you a barcode and an appointment slot. Anytime within the hour, you can come. Please come. We do have a lot of people who register and then don't show. So, you know, remember that once that hour fills up, we don't let anybody else come. So please try to be sure that you're able to come, and we would welcome you and hope that we can get you tested quickly and efficiently. Anything else from the outside? All right, anything else? Okay, great. Thank you, everybody. We'll see you tomorrow at 3. Thank you, Sarah. Here's my
Hit the stage.